We are not seeing anywhere near the number of cases here in the U.S. as they are in Italy right now. But there are already concerns about our healthcare system becoming overwhelmed. 10 on your side's Tamara Scott talked to a local doctor, and Tamara, he is really concerned about the lack of protective equipment.
That's right, specifically the masks and gowns that they use to prevent the spread of germs. The doctor I spoke with says the more people who test positive, the less resources they have to use, but says the public can help with this shortage.
If we take seriously not going out when we don't have to, not gathering in large groups of people, staying away from bars and clubs in the evenings for any reason, then we can keep this under control.
It's the same message health and state leaders have been preaching for weeks now. Social distancing, washing hands. But even as these practices are put in place, the number of cases continues to rise, which means more people are going to local hospitals using medical supplies.
A big issue. So one of the major problems we're facing right now is that there is, again, a shortage of material to protect ourselves.
Kenneth Q is a family medicine resident at Riverside Regional Medical Center in Newport News. He says they're seeing a shortage of masks.
Especially of the N95s. Those are the masks we use for the highest risk patients for things that can get aerosolized.
And gowns.
Gowns are very important to keep germs off of our clothing so that we don't bring it from patient to patient. And there's a severe shortage of that right now.
He says they're using existing materials conservatively. I asked him if it's possible they'll run out.
Depends on how responsible we are and how much the public is able and willing to listen to the government officials right now.
That's right. He means social distancing, washing hands, and treating symptoms appropriately.
The big thing that we're focusing on right now is flattening the curve so that we don't overwhelm that health system. And what that means is trying to keep the number of cases reduced until this thing runs its course.
Now, Dr. Q said that this is an evolving situation, so stay with WAVY as we bring you the latest. And if you have any questions about testing or COVID-19 symptoms, head to wavy.com. Tamara Scott, 10 on your side.